Good afternoon and welcome. Thanks for joining us. My name is Hamish Hilton from HealthCert and I'm assisting with the webinar this afternoon. So I'd like to introduce Dr. Isabelle Jonsson Lear. Dr. Jonsson Lear is a GP with a practice in Kingaroy, where she's coming in from us today onto the webinar. She's a GP that has a practice that delivers skin cancer, cosmetic services, and Dr. Jonsson Lear is a presenter in our advanced certificate of aesthetic medicine. Today, Isabelle will be sharing her experience on how she introduced cosmetic services into her practice, which she's found to be a great adjunct to her skin cancer work. Now, during the webinar, you're welcome to type in questions. You'll find in your GoToWebinar panel on the right-hand side, there's a little section for questions. If you type them in there, we'll have a good opportunity to do a question and answer at the end of the presentation. We have about 35 people with us already today, so we will get started on time, and please feel free to type your questions as they come. So I'd like to introduce and welcome Dr. Isabelle Jonsson Lear.
Hi, good evening. I hope that we're going to end up seeing most of you at our training courses, which is held throughout the year, and I think we've got 4 centers next year that we're presenting these in. But tonight is really just like a little appetizer to show you how you can incorporate an aesthetic medicine into your normal GP work, because I think that's probably one of the hardest things, and the biggest question that we always have is that how do you end up getting all this into your busy day? So I'll just run you through my journey and we'll get onto the PowerPoint. So I'm the owner of the Haley Health and Skin Medical Center, and I was a solo practitioner, and mostly did sort of gynae and obstetric work, GP work, the usual sort of range of stuff that you get in your practice. Immigrated from South Africa, where I obviously gained a massive amount of procedural experience, and also my background was more in trauma and gynae and obstetrics. And when I gave that up in 2003, I thought that I needed to get something else that keeps my interest going, and I embarked on taking on a franchise with Molescan at that stage and started on skin cancer medicine. And in 2012, I went out on my own and opened my own practice so that I could sort of like run my own scene. And Kingaroy, where I live, we serve quite a large population, including the surrounding areas. We've got about probably 30,000 people in the outlying farming area. And this is just a little picture of my little surgery. It's amazing what I've actually got packed into that little rooms. And that's just our signage in the front, where we advertise that we're a skin clinic, a cosmetic clinic, and also Healthy Heart, which is what I'm doing now. So basically in my practice, I had originally just the 2 streams. The one was the GP stream, which is what most of us do every day anyway, which offers, you know, your normal full range of GP care, your spiros, audios, drug and alcohol testing, syringing, suctioning of ear, minor procedures. I still do circumcisions and minor gynecological procedures as well. And I'm also was the NMA for the Tarong Coal Mount Power Station, and I'm also with Swickers, the piggery, which is one of the largest abattoirs in the country, and the nursing home care. The other stream of my practice at that stage was my skin cancer stream, and where I did the full body dermoscopy examinations, obviously photography, monitoring of these lesions, all forms of biopsies and excision, and then field treatments, which was only topical treatments. And then I had the Healthy Heart side, where I do body compositions, ABIs, and then of course stress ECGs as well. So these are the type of patients that sort of came in through my doors on a regular basis. And I have no doubt that if you work in a rural practice, that you will also see a lot of these kind of skins coming through your doors. And they're often quite a challenge on how to manage. And as you can see with these photographs there, my biggest problem was that I did not know what to do with people with this massive field damage. And that is where I ended up thinking of what else I could introduce to try and manage with that, because also, doing skin stuff, being in a rural practice, patients often came in to see me because they wanted other dermatological problems managed as well. And I think I've just summarized there for you. Probably acne and rosacea was two of the biggest problems that we were presented with and how to manage them. Also, cosmetic mole removal. People ask me, can you take these off for me as well? Scar therapy, and then you do a dermoscopy on people and they start asking you about all the tattoos that they've got that they're not happy with anymore. Sometimes they've changed partners and don't like it anymore. And obviously people started asking also, don't you do Botox? Don't you do fillers? And so these were the stuff that I started thinking about, that maybe it's a good idea if part of my endeavors to try and provide a field treatment, that I should also look at these other modalities. But obviously setting up a practice, and just building stuff like that, you're not quite sure whether it's going to be a success or not. So I ended up, my practice manager and I enrolled online for just a basic skin preparation course, like what the beauticians do. And we started providing treatments for preparation of the skin for our photodynamic treatments that we wanted to do. And we used one of the existing consulting rooms. Well, within about 4 to 6 months, we were so busy that we could not cope. And I then had to take the next step and decide whether I was going to employ a nursing sister or a beautician to drive that part of my business. And I decided to employ a beauty therapist, because I thought, whatever nursing stuff, I can do that, and I have got a nurse anyway. So you have to look at the initial outlay, and you don't want to go and spend a lot of money and then find that it's, that you're sort of like overcapitalized and not able to meet all your demands. And so you also need to keep in mind that obviously there's always training costs that's involved in it. And unfortunately, when I started up with this, there was not like HealthCert is now offering these fantastic courses, the professional and advanced certificates, and then also your professional diploma, which I wish that I had those available to me when I started up, because I present on all three of those, and it's just it's fantastic to help you to decide what to eventually end up doing. So some of the treatments that we on our menu that we established, we bought a Reveal imager, and then product lines, got some injectables, a microdermabrasion machine, and started with oxygen facials and acne management protocol, skin needling, which is all sort of like on the lower range of cost when it comes to purchasing of equipment, because once you start talking about lasers and things like that, it actually becomes very, very expensive. And then also the photodynamic field treatments. I think one of the absolute fundamental foundations for all your things is that if you introduce cosmetics or cosmeceuticals into your practice, you have to have a product line, because at the end of the day, these people do require preparations, and it's better that you are the one that actually drives that process, instead of them going out to buy the stuff in the chemist or even in the supermarket for that. And so that's the number one thing that you really do need to ensure. And there's various products that you can research there. You do not necessarily to use what I use, but you look at what it is, and also you have to choose according to your clientele, of course, because not everybody can afford these expensive cosmetic or cosmeceuticals. And but you also can't just have one range, because not everything suits everybody else. And so my story now at the moment is that I have, since we started in 2014 with introducing cosmetics into my practice, I had to now employ a second practitioner as well, who is doing mostly just GP work. And I'm trying to get somebody who would be interested in then teaching them all these as well, so that I may end up taking on a third person. We had to build on 2 more consulting rooms, of course, because I could not sacrifice the one consulting room anymore to the beautician, and we had to get on a separate section for her. And I now employ, of course, more staff members as well. I used to only have the one receptionist. We've now got 2 receptionists and a practice nurse. And my practice manager is actively involved in helping me on the skin side as well. And you get that the one side actually feeds off the other side. So what is the imager? The Reveal imager is a way in which we're trying to, because you're trying to think, how can you get the people to actually get into your cosmetic side of your surgery? And with the Reveal Imager, we started off with that, where anybody who came for a skin consultation had to go just through that. And what it does is it then shows them all the damage in the skin, and you can actually make the patient take ownership of their problem as well. And these are complementary add-ons to you, to your practice. And then the patients get into your practice, into your cosmetic side that way, because your therapists then discuss all their skincare and preventative strategies. So we've got just a pricing range. Obviously, you can't sort of like make things too expensive either, otherwise a lot of people can't afford it. As an example, we've got, like, especially with the acne management, we've got a flat rate for kids who are at school, and they will come in for the various treatments, and that's $69 that we charge them. So I've just put up there some of the pricing that we've got in our practice, because that was one of the things that I really struggled with when I started, was to know what to charge, because and I just collected pamphlets just everywhere from everybody to try and see how to put these things together. But eventually, that was something that I entirely now leave with my skin health therapist, and she's responsible for that side of it. We can't, as doctors, drive absolutely everything. So there's also still just cosmetic mole removal, the laser. We've got a fractionated radio frequency device, which is all stuff that we treat in our courses as well. The Botox and the fillers, which varies. And I try not to compete with anybody else. I've got my price range, and if somebody decides that it's not adequate, they want to go somewhere else, they can get it cheaper, it's fine by me. And then the biggest thing was really my photodynamic therapy that I wanted to introduce, because of the field treatment, which was what originally started me off in all of this. And we offer their spot treatments for $99 a treatment. Then, of course, the product sales, which they get from with these care products that they require for the aftercare, and also the preparation for the PDT. And then the prices range if we do it for rejuvenation, or if it's a full face or full neck or ears, prices range accordingly. So how's my week set out? I've got in my practice diary, it's booked out sort of consultation sections for where I do GP work, skin examinations, and surgical procedures. We try and stick to these blocks, but it obviously doesn't always work, because sometimes GP patients need to be seen and you can do nothing about it. So we have to double book. I also, on my nursing home visits, I look after 2 nursing homes, so I will do those on a Thursday, and I do them between 6 to 8 o'clock in the morning. And the good thing about it is you still find the patients in the bed as well. I don't look, you have to go and hunt for them all over the place. And then the occupational and medicals, I do those on a Monday to a Wednesday, and I do them from 7 to 8, merely just because it's quiet in the rooms then at that stage, so that if I have to do audiograms, that there's no interference. And then Fridays, I try and reserve for a bit of admin, emergencies, working out lectures, for staff training, teaching. And then also Fridays are my days that I will in the morning do ABIs, body compositions, and the stress ECGs, because you can't double book those either. So how do I work? I don't. It's absolutely imperative that if you want to run a section like this, that you do employ for yourself a skin health therapist. And you need a beautician, but then you invest your time and your money in getting them properly and adequately trained so that they can assist you with it. It leaves me free to do my doctoring work, so that I work between 2 consulting rooms. My staff are also trained to prepare the patients for me. And then, of course, in between, if they good sort of like your appointment scheduling will then allow you that if you need to go and inject somebody with Botox, or if there's fillers that need to be done, that you can have the time to do that. But all the fluffy stuff gets done by my therapist. I don't do that. So my cosmetic clinic actually sort of complements my skin cancer clinic, because, as I said, you get to manage all these other sort of skin problems that people have got, and the field treatments and management, really. So between the DERMDEN, which is what we gave it the name DERMDEN, so that just because we thought if it sounds too fluffy, the men won't come, but they're quite happy with that. So we work in conjunction with each other. She will prep the skins for me. She does all my photodynamic treatments now, all the vascular treatments, pigmentation, but we consult with each other and we cross-refer patients as well. So that's just what my treatment room looks like, because obviously, even though it's a skin cancer stuff, you want the treatment rooms to look nice and spend a bit of money on that. There's just another look of the treatment room. And these are just examples of outcomes that we've had. I mean, as you can see on the left-hand side, this patient has got quite a lot of solar lentigos and you know, field damage to her face as well. And on the right-hand side, she's had only one treatment with PDT, and it's apart from so obviously if it's not a cancer, they don't need 2 treatments, but the rejuvenation of the skin is absolutely phenomenal. She had 2 treatments eventually because she's also had intraepidermal squamous cell cancers on her face that we managed this way. That's just vascular treatment, 6 weeks post laser treatment, and that was only 1 treatment. And we've got so many photographs of people like that, and the men absolutely love it. The results are fantastic. This is just a vascular diffuse redness treatments, just example again of what we can get people to look at. And you know, décolletage areas are very difficult to manage as well, and often get a lot of scarring there. And if I've got somebody like with intraepidermal squamous cell carcinomas on cosmetically sensitive areas, I always treat it with photodynamic treatment and follow them up. Results are very good. This is males that come, they don't like these ugly sepques on their bodies, obviously, nor the women. So that's just an example again of what you can do with a laser. That's another lady, and I mean, she's absolutely stoked because you can imagine those lesions were very itchy, very dry, very irritating, and cosmetically absolutely dreadful because she's not old. So this is cosmetics mole removal that we also do. And I think the photograph on the right-hand side, it was only about 12 days after the treatment that those photographs were taken, and he was also very happy with that because he didn't want surgical scars, obviously. This is another patient where we treated with fractionated radiofrequency, and that was 3 treatments, 3 months post. And the skin just, you know, the fractionated radiofrequency, which is what we treat in our courses, teach in our courses as well, just helps all with collagen stimulation to fill the skin up again. And that is just also fractionated radiofrequency treatment where we used it for keloid scarring. Because, I mean, one of the things that worry people about the keloid scarring is that they're so tight, the scars. And this softened it up very much for the patient, and she was very happy with the result. And then just very important that if you do set up a cosmetic, just get your suppliers. And I mean, these are all information that will be provided in our courses as well for you, that you set up a good support system for yourself with other professionals. And I think one of the fantastic things about coming to the HealthCert training courses is that you build up a very good support system because you're interacting with other like-minded people and also people who are training you who are quite happy. And we make our time available because I often have patients after, sorry, not patients, doctors are coming to my surgery for placement here to come and see how I run my setup when they decide to come, and that gets arranged via HealthCert as well. And it provides people with a good backup, and the network is fantastic. So that's just my contact details, but you can contact me via HealthCert and they'll put you in touch with me. Okay.
Excellent. Thank you, Isabelle. That was fantastic. And if anyone's joined us late, this webinar is being recorded and will be shared with you for so that you can review it. And also, if you have any colleagues that are interested, you will be welcome just to share the link to the recording. But we still have at least 10 minutes, and we can probably run over a little bit for any questions. I haven't got any questions yet, but if you have a question, there's a panel that's called questions inside the GoToWebinar box. If you just click on the little arrow, you should be able to just type in a question and click send. And I might just start with one just to get everyone's interest going. Isabelle, when you just started the aesthetic medicine practice, what kind of investment, you know, just at the initially, obviously you have lots of services and machines now, but you didn't start with them all. What would be the guide of an investment if you were just starting with what you would recommend as the day one services?
Well, one of the things that you really do need to look at is introducing a cosmeceutical range. I mean, it's a difference between a cosmetic range and cosmeceuticals. And we purchased, because of the preparation for the skin, I purchased the ASAP products, and also they've got a beautiful microdermabrasion machine that also does what we call sonophoresis, where it's ultrasound treatment that infuse products into the skin. So that was I think those are, and I don't quote me on the prices, please, but if you look at it, it's under 10,000 obviously, and with that also comes your products. A reveal imager, that's about probably 3,000 or 4,000, depends on which one you buy, but you're looking at your initial start off with machines that cost you less than 10,000. A derma needling, that's also less than 10,000. So you unfortunately have to spend some money to do this, and I bought a Smart Lux for my photodynamic treatment, just merely because there are certain machines which also we cover that in our courses, which is good because you need to be able to prove that if it's something that you treat that's a skin cancer, that you are able to state that your machine can actually provide around about 36 to 39 joules. And some of these photodynamic treatment machines cannot do that. They can't provide you with a proof of it. So my Smart Lux was probably my most expensive item that I bought, and I think I paid about $50,000 for that. Laser, I started up much later because once you start looking at lasers, it's a very, very costly exercise. You need a special room, you need your laser license. It's like your driver's license, your possession license. There's a lot of licenses, involved with it, and especially if you like I'm in Queensland. Queensland have got very, very strict control around laser acquisition. So you've got somebody who comes and set it all up for you. So yeah, you probably look at about $60,000, $70,000 to start up with. I did eventually end up, of course, building the 2 rooms on, as I showed you on the photograph on the web, and that was also quite a costly outlay because just building the rooms is not so much, but to then actually make them look pretty, that's what costs you the money.
Understood, thank you. We've got a few questions that have come in now. Unfortunately, you answered the cosmeceutical one, but the same doctor's actually ordered a Heal Light 2, and I'm getting on Saturday. Any advice on how best to use it?
Well, what is it that they want to use it for? What sort of treatment?
830 and 415. I don't know what that means.
A Heal Light.
I guess they're the frequencies, are they?
Okay, what do you intend treating? What is it that you were aiming to treat? I mean, I need to know what they want to treat with it.
All right, well, whilst we're getting some more information from that doctor, there was a question around one of the images that you showed. Could you please describe what approach you used to remove the moles from the left upper lip in the photo you showed? Now, I'm not sure which one, but you might recall.
I use an Elman, and it's a frequency device, and it's a monopolar device, and it's got a little probe that looks like a diamond tip that I use with it, and I actually covered that in our training courses as well. It's an Elman device.
That's Elman, E-L-L-M-A-N, and that's the radio frequency. So it's like it does electrosurgery.
It's electrosurgery. Yes.
Electrosurgery. Yep. Excellent. Thank you. How do you cross-sell aesthetic services?
I did that when we originally started off. Now, of course, it's much easier because people are coming through the doors all the time and they're aware of it. But what I did in the beginning to try and get them to understand that there's a difference between, that there's an add-on to my skin cancer care is by actually also getting people to understand. And I do explain this to patients about apoptosis, that, our body has naturally got built into its ability to either kill itself. They commit suicide, the cells, if they know they're not healthy, or they can kill the next door neighbor. But the cells need to be healthy. And I advise patients that so that they can understand that there's a need for, that it's not just a cosmetic thing to try and get your skin healthier, but there's actually a medical benefit to it as well for them. And as you saw from the photographs, patients in this area have really got massive, massive field damage. So if you can sell it like that, and then by having the reveal imager where they would come and we then show them the photographs, and I've got lots of those in my course that I present on this. I've got photographs so that they can see what the Reveal Imager does. And the patients, because on the surface of the skin, you cannot necessarily always see the amount of damage that's there. But once you put them in that Reveal Imager, it shows the vascularity, it shows the pigmentation. And patients are shocked when they see how damaged their skins are. And then you offer them solutions for what they can. And they will then come back to you, but you need to have your cosmeceutical products ranges that you are going to present. And really that's probably one of your starting points, is to have a cosmeceutical range. And then when they come with the Reveal Imager, you then get them introduced, and then of course your therapist can talk to them. They will then ask questions, you know, what is there that we can do? We've got a menu as well here that we give patients, and they can then look at what the treatments are that we offer, and there's also of course the prices is on that as well.
And thank you. And you actually also preempted a question around the Reveal Imager. So you mentioned it for taking those images. The question was, the same, would you use for imaging skin lesions, or is it only for the cosmetic aesthetic?
It's only for the aesthetic side. It's really just to show people, and we give them a printout of it as well, so that there's something in their hand that they can take ownership of the fact that they've got massive damage on their faces. And of course the Reveal only works on the head neck area, but it's definitely not, it doesn't replace your dermatoscope.
Thank you. All right, next question. Oh, just coming back to the Heal Light, it was mostly acne and skin rejuvenation.
Okay, I'm not very familiar with the Heal Light, unfortunately. I've got a Smart Lux, and so for acne, I will use my Smart Lux, you know, the infrared and the blue light on it. For healing that. I also use that quite often for, like, which fortunately doesn't happen often, but if I do have a graft failure, I will use it on that as well. And then of course I see a lot of diabetic patients as well. If they've got ulcerations or venous ulcers, you can use your light on that as well for rejuvenation and for just improving the health in the skin. And it's amazing how quickly you can heal up ulcers with actually putting them under the light, because you can't just use your light just for, you know, it's got to have, it's a very expensive piece of equipment, so you want to be able to across, you know, treat a wider range of problems with it as well. So it's not just standing there doing one job.
Excellent, thank you. A follow-up just on that, Elman. The question is, do you shave the mole and use the Elman for the base, or do you use the Elman to pare down the mole directly?
You literally, because it's incredibly sharp, the cutting side that you're using. So I literally peel it away until I've got it level with the skin. And it's just non-stop short little movements that you do. And, you know, I mean, I started because it was very difficult to start off with knowing how deep to cut and how hard to push on that little probe. So, and the last thing you want to do is do one of those, oh my goodness, you know, and then wishing that you could push that piece of skin back that you've just cut too deep. So older people, if they've got seborrheic keratosis, I've asked some of them, would they be willing for me to try this machine out on those, and I'll peel it back for them. And I did it on scalps and faces and backs and everything until I could just get the feel for how hard I need to push on it. And then I started on older people once again, because I mean, I'm an old person as well, but we're a little bit more forgiving. You know, some of us are not so cosmetic. I am still cosmetically minded, but you know, sometimes they're not really all that concerned about it, and they're quite happy for you to try it. And of course, I didn't botch any of them up, but you do need to try it out before you touch a cosmetic mole, if somebody comes for those specifically, because it's a skill that you need to acquire. It really is. I demonstrated with placement here with me. I usually try and get some people in that wants cosmetic mole removal done during that period, so that they can see and just how it gets done. I've made some videos on it as well, but one day I'll probably.
Thank you. Just the name of the light that you mentioned, the Lux, just what was that? Someone? Smart Lux, S-M-A-R-T-L-U-X?
L-U-X, yeah.
Yeah.
The Omnilux is also another one. And then there's the Actilight. Actilight is just treat small areas. I think the Omnilux and Smart Lux, they can treat large areas. Like I can treat the back as an example, or arms, or full arms, or head neck area with it. the light covers it.
Thank you. A bit of a business-oriented question. Advertising tips, Facebook, Instagram. How do you market in your local area?
You've got to be very, very careful. Of course, APRA watches everything we do. So you must make sure that you get rules and guidelines as to what you can and what you can't. Your best advertising is still by word of mouth. And because I'm sort of doing a lot of skin cancer work, we have got a Facebook page, and where we will put some stuff up that's coming up. But of course, you can't, or you're not allowed to offer discounts or anything like that. So just be careful that you don't get caught out with something like that. And then, of course, you don't want patients to write comments on what you do either. But I think it's a bit. No, I'll keep my opinion to myself. Yeah.
Yes, it's complicated, but there is a lot of documentation on the APRA website for it. So it's best, obviously, to be guided, and there is challenges with testimonials, etc. So it's a fine line.
Make sure you stay within those lines. But ultimately, eventually, if you provide a good treatment, your clients will tell the next client, who will tell another one, and that's most of our stuff comes in by word of mouth. And I do not necessarily. A lot of the patients obviously are not my GP patient. I'm not their GP doctor, and a lot of them only come to my cosmetic side of my clinic. We don't see them for anything else.
There was a follow-up. Can we put poster of services inside the clinic?
Yeah, I've got a television in my waiting area, and on that we put like some of the images that you've seen now. We've got patient permission. And we actually put those up on it as well, so that people can see what it is that we are offering, what we can do. And like with the vascularity, men often come in because they see it and they didn't even realize they could get rid of those horrible veins on their faces. And the cosmetic results, absolutely phenomenal. So, yeah.
2 more questions, and then we'll just be a little bit over, but I think that's very good. We've had some very useful questions. You mentioned that you have to invest a large amount regarding the devices. How long before you actually got a return from your investment?
That's a very difficult question to answer because, I'm unfortunately one of these people. I've never let money guide my life. I do what I enjoy. I don't think a laser will ever make you rich. It's a very expensive piece of device, but it adds quality to the services that I can provide here. I've often been asked, have I paid this off, or do I think I've made enough money to cover that? And I must be quite honest with you, just because of how I work, I don't know, and I couldn't really be bothered. What I do know is that my skin therapy side now probably comprises about 20% of my income, which I think is pretty good if you think about it, that it's not a high range, money range stuff. I mean, probably the most expensive thing you'll do here is we've got a electromagnetic device that we use for a bladder toning, a Kegel device, and we charge those probably $2,700 for 6 treatments, and people pay it upfront on a credit card. So that's probably the most expensive treatment. Radio frequency treatments range about $1,500, which patients can either pay in one thing or they pay $500 when they come for the 3 treatments. So that's probably the most expensive. But yeah, it's a good income, but I've never looked at whether my machines, I have no doubt they have paid for themselves, some of them, but I think my is probably the one that will take a bit longer to pay to make it work for you.
Excellent, thank you. And the last question is probably a good segue into some final words from me, but I'll just ask your recommendations. Read this one. How far can you go with just a professional certificate in HealthCert? Or if you have to attend the advanced ones, how long should you wait until you do the more advanced of the courses?
I think that you can do them pretty quick. I mean, the time that we've got, because the important thing is that this gives you an overall a view of all the stuff that can be done and how to incorporate it and get you comfortable with it. It all depends on your level of confidence. When people come because I teach the chemical peel course in the certificate levels, I think that when you leave the first one, you really do need to go and implement those things and try them out, so that when you come to the next one, that you've already done some of the work. And the stuff is not that difficult. I mean, you're all medical doctors. You all got good skills already. And a lot of the stuff you can do yourself. But if you want to go for this completely full-fledged, you really do need to employ a beautician, teach her, get her trained as well, and then let her provide and drive the side of it. But your starting point is you need to look at field damages, and you need to get your cosmetic products, and you need to get something like the Reveal Imager that will give patients an ownership so that you can get them into your cosmetic side. And then advertise Botox and fillers, because everybody loves those.
Excellent. Well, thank you, Isabelle. All right, well, 35 minutes. We'd like to stick to our time. Please, if you do have any other questions, please feel free to email info@healthcert.com and we can pass them on to Isabelle or the appropriate one of our faculty or one of our team. This will be a recording that we will send out to you. If you are interested in the aesthetic medicine education that we provide, the next event's being run in Melbourne towards the end of February, and we're running all 3 levels there. So if you have done one of the early levels, the advanced and the professional diploma will be run there. Or alternative, if you're starting from an entry level, the professional certificate, and that's the 22nd and 23rd of February in 2020. And Isabelle will be there herself as well. So thank you again, Isabelle, for joining us, and everyone else, and we look forward to catching up next time.
Good night. Hope to see you at the courses.